Long-term effects of viral infection have been reported in the scientific literature for over 100 years, and in that sense, long COVID is not unusual or unexpected. And in fact, if COVID-19 didn't cause long-term effects in a certain percentage of the people it infects, it would be the only major pathogen that didn't. So what we long haulers are experiencing is a post-viral syndrome that's not that unlike other post-viral syndromes in many ways. The flu virus, for example, can also lead to brain inflammation. Myalgic encephalitis, or ME, or chronic fatigue syndrome, also involve brain inflammation. And because no cure has been found for these chronic infections at present, masses of research is going into long COVID because post-viral syndromes tend to become established and not disappear on their own. In severe cases of a respiratory infection, like flu or COVID-19, the brain doesn't get enough oxygen from infected lungs. Starvation of oxygen can cause temporary or permanent damage to brain cells. Some of the symptoms of this could be vision problems, pain, dizziness, fatigue, and brain fog, anxiety, depression, insomnia. The COVID-19 virus also attacks brain cells and nerves directly. Some studies of long haulers have found that there's a reduction of activity in some areas of the brain. Hormones such as serotonin, the happy hormone, and dopamine, the motivation hormone, can be decreased in an oxygen-starved or inflamed brain. So loss of joy and motivation can also develop. Neuroscientists at University College London have shown that COVID-19 also causes blood vessels that supply the brain to narrow, causing reduced blood flow and a tendency to clot. This causes problems with mental ability, including memory and alertness, as well as blood pressure, heart rate, and breathing. And it can even cause coma. An infection with C19 can even cause stroke. In a UK study published in August 2021, the brains of 401 people who had had previous brain scans before a COVID-19 infection were found to have been infected by the virus. This was seen to have occurred via the nose, and multiple changes to brain tissue were observed, including multiple mini-strokes within the brain. Certain brain cells may also have become hyperactive and undergo a process known as excessive pruning, where they start clearing up cells that are still healthy in the brain, as if they were waste. This could explain some of the memory loss and poorly functioning memory in long COVID. Memory cells can be completely obliterated. It's not uncommon for people who suffer respiratory distress to have no recollection of their time in ICU. There was a case of a man who, after having had a bad case of COVID, couldn't recall a trip to Paris he had been on 3 weeks before his infection. Healthy blood vessels are relaxed and open to the flow of blood, and they release substances to prevent blood clotting and inflammation. But COVID latches onto the ACE2 receptors within the inner lining of the blood vessels within our lungs. A 2021 study at the Oxford Biomedical Research Centre identified persistent damage to the lungs of COVID-19 patients at least 3 months after they were discharged from hospital, and for some patients even longer. The fascinating thing about this study is that the damage was not detected by routine scans such as X-rays, MRI or CT scans in those patients previously. And so those patients would have, if not at this Oxford Research Centre, been told that their lungs were normal. Further research by that team has shown that patients who were not hospitalised but who are experiencing long-term breathlessness may have similar damage in their lungs. The abnormalities, not normally visible on normal scans, are preventing oxygen getting into the bloodstream as it should in all parts of the lungs, according to the study's principal investigator. Okay, so that is your enemy. Now, what are we going to do about it?